Okay, let's talk about chronic low back pain. If you've ever had it, you know exactly how frustrating it is. It's one of the most common reasons people end up in a doctor's office, and yet it can be so hard to solve. We're going to dive into this because the real problem, well, it might not be what you think it is at all.
See, we're all sort of wired to look for that one perfect fix, the one stretch, the one treatment that's going to make it all go away. But for millions of people, the real fight isn't with a slipped disc or a tight muscle. It's with something invisible, uncertainty. And today, we're going to pull back the curtain on that very dilemma.
I mean, this is the question, right? It's the one that bounces around in your head. You've done the exercises, you've tried resting, you've seen the specialists, and yet, there it is, the pain. It's this super personal, deeply frustrating thing that just sends you on a mission to find some answers.
And that mission, that search for answers, usually lands you in front of a healthcare professional, maybe a physiotherapist. And look, when you're in pain, what you want is totally reasonable. You want to know what is wrong, why it's wrong, and you definitely want to know how to fix it. You just want a name for your problem.
But here's the tricky part. Getting that name, getting that scan result, it can be a real double-edged sword. Let's say a patient gets a scan and it shows a disc bulge. Well, suddenly, that disc bulge can become the only thing they focus on. As this physiotherapist, Margaret, points out, they get fixated on a disc, even if that bulge has literally nothing to do with their pain. The diagnosis itself can actually become the roadblock.
And this really gets to the heart of the conflict. We tend to think of our bodies like cars, right? Find the broken part and fix it. But the clinical reality for most chronic low back pain is, well, it's messy. More often than not, there isn't one single broken part. And those scans, they frequently show things that are totally normal for your age and have zero connection to the pain you're feeling.
All of this brings us to this really crucial concept called diagnostic uncertainty. Now, let's be super clear here. This is not about a doctor or a physio being bad at their job. Not at all. It's a fundamental challenge that's baked right into the nature of chronic pain, where it's often just impossible to point to one single thing and say, aha, that's the culprit.
So, to really understand this from the inside, we're going to look at a fascinating study from 2011. Researchers sat down with 23 different physiotherapists to get their side of the story. How do they actually deal with this pressure? What happens when a patient is desperate for an answer that science just can't give them?
And right away, you can just feel the pressure. This quote from a physiotherapist named Jean, it says it all. She's saying that clinicians feel like they have to give a diagnosis, even if they're not totally sure, just to give the patient some hope and a reason to buy into the treatment. Now, this isn't about trying to deceive anyone. It's really a communication strategy. By giving a patient, something to hang their hat on, a simple, easy-to-understand label for their pain, a therapist can build trust and get them engaged with a treatment plan. It takes this big, scary, abstract pain and turns it into a concrete problem we can work on.
Man, do some of these explanations get creative. This physiotherapist, Andrew, uses this analogy of a disc being like a jam donut. You bend over and you squeeze the gel out. It's memorable, it makes a weird kind of sense, and it gives the patient this clear mental picture of their pain. It's a way of creating a sense of certainty where there really isn't any.
But here's the thing. This pressure doesn't just come from patients. A lot of it comes from the physiotherapist's own training. They're mostly taught using what's called the acute model. It works perfectly for something like a sprained ankle. You assess it, you diagnose it, you treat it, and boom, you see a change, often in that very first session.
And just listen to how Peter, another physio, puts it. Their training creates this professional culture where getting immediate results is the sign of a good therapist. But that whole model just completely falls apart when you're dealing with the complexities of chronic pain. It doesn't respond to quick fixes, and that sets everybody up for a ton of frustration. Which leads us to the really tough question, right? What happens when the simple diagnosis and the jam donut story and all the treatments, what happens when they don't work? When the pain is still there? Where does all that pressure and all that frustration go?
Well, a lot of the time, it first gets pointed at other clinicians. There's this tendency to think, oh, the last person must have just gotten it wrong. Catherine's quote here is a perfect example. This idea that, sure, you've had treatment, but you haven't had my special technique. I'm the one who's going to fix this.
But what if that doesn't work either? Well, then the focus can shift again. And unfortunately, the blame can start to turn toward the patient. The story changes from, we can't find the cause, to the cause is you and the things that you are doing.
And you can see just how intense this can get. This kind of professional frustration, which is born out of this pressure to get results, can bubble up as this really dominant, almost confrontational communication style. It's almost like a last-ditch effort to get control of the situation and make sure the patient does what they're told.
So in this kind of high-stakes, pressure cooker environment, you can see how these negative patterns start to show up. Clinicians feel this need to own the problem and control the outcome. And sometimes they might even start to stigmatize patients, maybe doubting how much pain they're in or blaming their personality.
But let me be really clear. The study doesn't paint these therapists as villains. Not at all. What it really reveals is a systemic problem. These are good people who feel underprepared by their education to handle these complex, chronic conditions, and they feel isolated in their daily work when they come face to face with all this uncertainty.
So, what's the answer? Well, the research points toward a whole new way of thinking. It starts with just admitting there's a problem and training clinicians differently. We have to move past that quick fix model, give them the communication skills to talk about uncertainty openly, and create systems where they actually support each other.
And that support piece is so key. As Tracy says here, having a mentor, an experienced colleague you can talk to about these tough cases, it's brilliant. It's crucial. It helps younger physios build confidence, not in finding a magical cure, but in just navigating the gray areas right alongside their patients.
Which kind of brings us full circle to this final, really important question. We started this whole thing with the patient's desperate search for an answer. But what if that search for one single, certain answer is the wrong path? Maybe the most healing thing isn't an expert saying, I have the answer, but a partner saying, I'm not sure, but let's figure this out together.